Hi, this is Dr. Jason Dulac coming to you from my office in Springfield, Virginia. We get a lot of questions about Invisalign or clear aligner therapy. Today, I want to answer some of the most common questions for you. So what is clear aligner therapy? 50 years ago, you had these hard wires, these bad brackets. They went on the teeth, a lot of force, caused root resorption, a lot of problems for people, pain. People think braces hurt. Clear aligner therapy, instead of the wire moving the teeth, the tray moves the teeth. So we're setting a plastic tray slowly and incrementally over time, very comfortable, very effective, very predictable. Invisalign is the brand name. It's the Kleenex. It's what everyone knows. We do Invisalign. We also do other clear aligner therapies that I think are a little better and more effective for my patients at the office. It's a very easy process. Come in for a consultation. We'll make sure the process is right for you. We'll get a scan of the teeth. We're no molds. There's no putty. You're not going to gag on something. And we'll get a scan of the teeth. We'll design the case. I'll go over it with you. I'll let you know exactly how many weeks it's going to take. And we'll order the aligners and we'll move forward. And about a third of the way through that, you're going to be so happy. It's like that internal reward you get when you start seeing the change. Like you've been going to the gym and start to feel good. It takes a couple weeks, but midway through the case, people start to become more confident in their smile. You just see the change in the person. When I see them 6 months later after treatment, they're just smiling more because they're happy, they're more confident. It's a very rewarding feeling. And at my office, we do free whitening with every single Invisalign case. So you can use those trays as whitening trays. And I give you free bleach for every case. So not only are your teeth going to be straighter, they're going to be whiter, they're going to pop more, you're going to see it, you're going to smile more, you're going to smile more in family photos. Your wife and kids are going to think you're happier, not some curmudgeon all the time. But, I think it's just, you're going to be so happy with the results. How does Invisalign or clear aligner therapy compare to traditional braces? So with traditional braces, the wire is moving the teeth and the brackets on the teeth are positioning the teeth. With aligner therapy, the clear aligner therapy is positioning the teeth. That's the only difference. We do both at the office. We also do functional orthodontic appliances, which are things that help promote jaw and bone growth. So we have all those options at the office. If I don't think clear aligner therapy is the best option for you, I will tell you we work with a lot of great specialists in the area too. So if I think that it's a very complex case involving multidisciplinary care, we work with oral surgeons, orthodontists. Anyone you need to get the result that I know you want and will be best for you is what I'll recommend. I get this question a lot. Is Invisalign faster than braces? They go the same speed, so it doesn't really matter. Why is Invisalign and clear aligner therapy considered more comfortable than braces? Well, for one thing, you can't put too much force on the teeth with that plastic aligner. The pain and discomfort caused by traditional orthodontic therapy is caused by excessive force. There are a lot of things in traditional orthodontic therapy that have been done to mitigate that, but that plastic strip is only so much force it can put on your teeth. No matter how hard you shove it in there, it's not going to put too much force on your teeth. So it's more comfortable, but it's more cosmetic. So, a lot of people, when they put wires and brackets on, their tongue gets raw or their cheeks or lips get raw. They got to cover it with wax. Clear aligners, you're not going to see them mostly from 5 feet away, and they're not going to rub your cheek and lip as much. So most people consider them to be more comfortable, more cosmetic, and more comfortable. How long does clear aligner therapy or Invisalign take to straighten teeth? It's a good question. Depends on the person in the case. Could be a couple months. Most of my cases are around 6 to 9 months. Rarely they go over a year. So quicker than you might think. What is the process involved in Invisalign or clear aligner treatment? It's very easy. You come in, we answer any questions you have, go over everything, make sure it's right for you. We take a scan of your teeth, takes 10 minutes. We take some photos. I digitize those and mock up the case while you're out of the office. If you want to see it before we start, I'll give you a call, give you a consult, we can move forward. Otherwise, 2 weeks later, you get your aligners, you come in, we put them on, we go over how to use them again, and you're good to go. What are Invisalign trays and how many will I need? The tray is the aligner, the clear plastic thing that goes on the teeth. So one tray is usually good for 1 to 2 weeks. When we do a case, we take how much movement we need for the case, back it out by 0.1 to 0.2 millimeters. That's how many trays you're going to need. So you're going to move the teeth a millimeter, you need 5 to 10 trays. So every tray moves every tooth 0.1 to 0.2 millimeters. So the number of trays you get is dependent on the case, but the time that you'll wear them, I recommend 10 days, but there's some flexibility, 1 to 2 weeks for most people. I recommend 10 days. It works well for most of my patients. You do not need to come in for every tray. I will give you a large sequence of trays, and I can even check the fit of those remotely. So there's an initial visit, there's a final visit. The in-between visits are few and can be done over Zoom or FaceTime, photo, whatever. Do you sleep with Invisalign or clear aligner trays? Yes, 100%. If you do not wear those trays 22 hours a day, they will not work. So that's the number one thing I tell people. If you're going to spend this time and money, make sure you're committed to wearing them. I guess the plus with that is a lot of people don't snack as much and they lose weight. So, but yeah, you do have to wear them 22 hours a day for them to work, day and night. Take them out to eat. If you're going to a special social event, party, 6 hours, okay, wear it the other 18. That's not really moving forward, but you're not moving back. There's some flexibility in there. But if you want to do this, make sure you're committed to wearing them 22 hours a day. I hear this question, is there anything that could disqualify me from using Invisalign? Rarely. So you want your teeth to be healthy, free of decay, gum disease, all that good stuff. And that's for any orthodontic treatment. It's not just Invisalign. There are very, very, very few select movements that Invisalign cannot do. We do traditional orthodontic therapy. We do functional appliances. So we can combine Invisalign therapy with functional orthodontic appliances, or if you need traditional braces, we can go that route. But that's few and far between. They're doing teen Invisalign now. So if you think your child is a good cooperator, which most teens aren't, but at least the boys, I wouldn't do it for them because it's going to be a waste of your time and money. But if you are committed to wearing them, they will work. Can Invisalign or clear aligner therapy fix crossbite? So crossbite is when the teeth are under or overlapped. So most people, their outer teeth go outside their inner teeth. A crossbite is when that's flipped. I consider clear aligner therapy or Invisalign to be the best way to fix a crossbite in most cases, because to fix that, you have to separate the teeth. So if you're closed, the tooth can't move past each other. So if you have traditional braces, sometimes you have to put like a bump or a step on the teeth to keep you from biting so that the crossbite can correct. With Invisalign, the trays keep the teeth apart, so they're going to correct like that on their own. Now, one thing I do tell all my patients who are going through crossbite treatment is there's going to be a time when your teeth line up edge to edge, and that's going to feel weird. It's going to be uncomfortable. Your bite's going to be changing throughout the whole treatment. Don't worry about it. It's going to be temporary. By the time you get to the end, it's going to be better than what it was before. Is Invisalign or clear aligner therapy painful? No, it's not. First tray, first couple days, you might have a little mild discomfort, inflammation. Take Tylenol, Motrin, whatever you want to take. When you put the first aligner in, each new aligner, you might feel pressure on the teeth for the first 12 hours. I usually tell people, put them in before you go to bed. By the next morning, you're not going to feel it anymore. But no, it's not painful at all. Does dental insurance cover orthodontic therapy, Invisalign, traditional orthodontic therapy? Yes and no. So every insurance carrier, every plan is different. I have four great people at the front who only work on insurance. So before we start any treatment, whether it's Invisalign or any other treatment, we're going to check your insurance benefits for you first. You don't have to worry about that. We'll take care of it for you. So some people do have adult ortho coverage. A lot more people have orthodontic coverage for teens, but a lot of plans do have adult ortho coverage. And if you don't use that benefit, you lose it. So if you've got adult ortho benefit and it's something you're interested in, why not move forward? One question I get a lot is, doctor, why shouldn't I just do it online myself? A lot of reasons. One, Smile Direct Club, the most common one, is bankrupt now. So I don't know what's happening to those patients, but hopefully they're going to get their cases completed. But the company did file for Chapter 11. So I have had some patients do it successfully. If it's minor movement, it could work, but you're taking a risk there. You have to understand that risk, and I would not recommend it. I would rather you come in for a consult for $49 and let me tell you if I think it'll work for you than you just trying it. I've had a lot of patients come to me because that messed their teeth up and they're mad with the results. And then it's oftentimes more timely and expensive to fix than it would have been to do it right in the first place. So it can work on a case-by-case basis. I cannot recommend it to you because it's unsupervised care, and I would never recommend that to anyone. I've seen it work, but I wouldn't recommend you gamble with your health. I get this question a lot. Is it for me? Will it work for me? Can I move forward with Invisalign or clear aligner therapy? Most of the time, yes. Give us a call. We'll have you in. We'll go over the process. If you're interested, we'll take a scan. I can show you how that scan's going to look, how long it's going to take, et cetera, et cetera. So it's something that's an option for most people, and I'd love to answer any questions you have. Just set up a consult at the office. I hope I've answered some of your questions on Invisalign and clear aligner therapy. Every case is different. Give us a call. We're here to help. 703-451-4500. You can text us or call us at that number. I'd love to see you at the office.